Hi, everyone. My name is Dee Dee Gardner. I'm the Chief Research Officer for the Allergy Asthma Network. We want to welcome everyone to this afternoon's webinar. We are extremely fortunate today to have a real treat with Dr. Jessica Fino as our presenter. We have a few housekeeping items before we start our program today. First, all participants will be on mute during the webinar. We will record today's webinar and post it on our website within a few days. You can find all of our recorded webinars on our website at allergyasthmanetwork.org. Scroll to the bottom of the page to find our recorded webinars and upcoming webinars. This webinar will be 1 hour, and that includes time for questions. We will take those questions at the end of the webinar, but you can put your questions in the question and answer box for Zoom at any time. The question and answer box is at the bottom of your screen. We have someone monitoring the chat if you have questions or need any help. We will get to as many questions as we can before we conclude today's webinar. We will not be offering continuing education credits for this webinar, but do have a certificate of attendance available if you need it for your records. A few days after the webinar, you will receive an email with supplemental information and a link to download the certificate of attendance. We'll also try to add the link to the certificate in the chat. So let's get started. Today's topic is real-world tobacco cessation strategies and understanding resource in under-resourced communities. Around 61.6 million individuals in the United States currently engage in the use of tobacco or vaping products containing nicotine. Moreover, within the past 30 days, approximately 23.6 million people have developed dependence on nicotine. Exposure to secondhand and third-hand smoke poses notable health risks to the general public. Today, Dr. Fino will discuss effective techniques for teaching tobacco cessation to communities with limited resources. This webinar will also explore and analyze the various methods patients employ, such as nicotine replacement and nicotine substitution, for managing their nicotine consumption. It is my pleasure to introduce Dr. Jessica Fino, who is an assistant professor of respiratory care at Midwestern State University in Wichita Falls, Texas. Dr. Fino earned her Doctor of Education for Health Professions from A.T. Still University. As a respiratory therapist, she's experienced in adult critical care, neonatal, and pediatric care. Dr. Fino is a freedom from smoking facilitator through the American Lung Association. Thank you for being here today, Dr. Fino, and I'll turn it over to you.
Hello, everyone. It is a pleasure of mine to be with you today. A little bit about me is I've been a respiratory therapist for 14, almost 15 years. And like Dee Dee said, I am a facilitator for freedom from smoking through the American Lung Association. But my smoking cessation education, I've been a advocate for teaching this topic for about the last 4 or 5 years. And I started with the Fresh Start program through the American Cancer Society. And they've kind of evolved their content a little bit. And so I've crossed over to the American Lung Association with their freedom from smoking program. So I'm very excited to help present this topic and help the Asthma and Allergy Network meet this portion of their mission. So just a little bit about me is you will hear me reference the program that I've taught. And so I wanted to give a little bit of background information about my program so that you can have a better understanding of why this topic is near and dear to my heart. So I am an assistant professor at Midwestern State University, and I recently took over our rehab and health promotion course as well as health promotion. And so I knew I wanted to start a project with my students where they were allowed to teach smoking cessation. So initially I started with our local health department, and more or less we witnessed and watched them teach their program. And we kind of just got to be listeners on that topic. And as you know, COVID happened in the last few years, really that program kind of went away. And so I immediately identified the need in our community for smoking cessation. So that's whenever I took on the program myself and became a freedom from smoking facilitator and started offering the classes through the university here and allowed my students to teach alongside me. Well, that was great, but then I also found that when offering classes to the general public, oftentimes they were somewhat unreliable in showing up, coming, and really ensuring that I had a great attendance as far as participants. And so I recently partnered with a transitional housing unit in my local community, and it's known as Sober Living Wichita Falls. And we teach smoking cessation to individuals who are recovering from addiction. Oftentimes, it would be illegal substances is their addiction history, and so they have fulfilled that requirement of their program. But smoking is oftentimes kind of in today's society the acceptable addiction. And so that's where I wanted to come in and share, okay, well, in the norms, it may be acceptable by society because it's not oftentimes illegal, but that's where I wanted to jump in and offer this program to these individuals. And so that's a little bit of background on that. So again, you'll hear me reference the American Lung Association often in my program, and that's just because that's my own experience. I'm not aiming to necessarily highlight any particular product or service. So these are my objectives. I want to describe the different approaches to providing tobacco cessation, and oftentimes particularly targeting those under-resourced communities, because personally I believe that not all smokers are the same and not all smokers have access to the same resources and programs. And so I believe the message should be the same, but the approach to teaching it for every group doesn't and shouldn't always be the same cookie cutter type approach. And then I also want to identify the obstacles and common misconceptions associated with helping individuals in their journey to quit nicotine, because each group, whether it be, like I said, with my personal experience, the homeless or transitional type population, whether it be youth at a clinic or the general public, each group is going to present with their own set of obstacles. And so being prepared for the different obstacles in the different communities can sometimes help for produce a better program and help the participants meet their goals. And then lastly, I want to recognize the role that we all have in spreading the hazards of smoking, and also tying in a little bit of information about vaping. I believe personally, my message is that it should be more than just smoking is bad for you, don't do it. I have found over the years that the individuals that I work with, they all know that. They know that it's bad for them. It's just the quitting is so hard that's where they really struggle. And so this is how I'm going to break it all down for us today. I want to look at this information from the perspective of who are we wanting to teach, how are we going to develop a strategy, and then how are we going to execute it and put it into action. So whenever we look at who our audience is or who we want to teach, smoking is the leading cause of preventable death in the United States. So on average, about 480,000 deaths occur each year due to smoking related illnesses. And so to put that into perspective, in preparing for this presentation, I started looking up populations of about between 475,000 and 500,000 individuals. And that, for example, that would be Colorado Springs, Colorado, or the entire population of Atlanta, Georgia. Okay, if we lost those entire cities every year, that would be approximately how many people die from smoking related illnesses each year. So whenever we start looking at our target audience, you have quite the number to draw from. And that smoking in itself is directly related to about 50 billion in the total economic burden, and about 30 billion of that is directly related to healthcare expenditures. So I don't know about you guys, but I can think from my experience of working in the hospitals of a lot of places I would like to spend an additional $30 billion. On top of that, the average person who is a smoker can spend around $6,500 a year on medications, doctor's visits, copays, and durable medical equipment. So I think that's important whenever you start looking at these under-resourced communities, because you realize a lot of times money and funding, either for the programs or for the participants themselves, is not a commodity. And so oftentimes we have to look at additional areas to gain funding. And I think addressing those components with the participants sometimes makes it a little bit more relatable to them, because they don't really understand how much money they're spending on their tobacco products. Okay, so looking at finding your audience within your community, here's the latest information from the American Lung Association breaking down the different ethnic groups. When we look at the demographics, I often want to look at who our smokers are. So over the last decade, we have seen that the total number of smokers have declined. However, it's still, like I said, a major contributor to the cost of healthcare on the healthcare system, and it's still the #1 preventable disease. So typically there are more men that are smokers in the United States than there are that are women. In the last 2 clinics that I've conducted in the last couple of years, I've had probably about between 15 and 20 participants in each clinic. I've actually only had 2 of them out of approximately, let's say 50 people. I've only had 2 of them that admitted to picking up the habit of smoking after the age of 18. So I think that very much correlates to our trends that a lot of times individuals who are long-term smokers pick it up at an age of adolescence. So I think that's really important aspect to consider whenever you start looking at recruiting in schools or looking at youth, that it's found a lot of statistics currently support that a lot of individuals pick it up in their middle school years. And so that's again another area that helps us identify where our true audience is. And so I also like to identify interests within the community. So are there any commonalities among your target audience? For example, if you were wanting to look at schools or youth, if you were looking at like after school programs or schools, are they primarily athletes? Could we, recruit based on the health benefits and the performance benefits if they would quit smoking? If you are potentially looking at rehab clinics and things like that. I know I found a lot of times when working with actual physicians' offices and maybe pulmonary rehab type clinics, it's the logistics of getting the patients there and getting the participants there. So would it be possible to potentially offer the classes at a time in which, could either before their program starts or before their appointment starts, or shortly after their appointment ends? Could we get them all there, maybe scheduled on the same day? Just different ways that we can tailor the recruitment to appeal to not only their specific interests, but encouraging them to actually attend, because I feel like a lot of times with smoking cessation classes, getting them there and getting them to attend is oftentimes half of the battle. And sometimes, depending on which community you're looking at, it may be 2/3 of the battle is just getting them to attend and show up and be there. So you also have to consider that whenever we look at tobacco and nicotine, that the big tobacco referred to as, the primary tobacco industry altogether, they're very, very good at what they do. And what I mean by that is they are very, very good at advertising to these different communities somewhat disproportionately. So they target a lot of times the low income and at-risk communities for their products. So I feel like we have a greater appearance of ads predominantly, let's say like in our African-American communities, where we may see larger advertisement in near homeless shelters or that type of environment where they support LGBTQ plus community, where sometimes the commercials or the ads on the billboard signs and things have marketing that appeals to those communities. So I have to if they're that creative in their marketing of their product, I feel like we have to combat that somewhat with our creativity in marketing our smoking cessation programs, because if they're going to be good at what they do, we're going to have to be good at what we do. So when I look at developing a strategy or how I'm going to approach teaching a class, how am I going to find participants, what content am I going to teach, I break it down by looking at the different programs. So again, I know that there are different programs out there. Some of them are tailored to be shorter. I know that's one of the, I feel like not necessarily a downside of the Freedom from Smoking through the American Lung Association, but it is one of the longer programs. So it is designed to be over 7 weeks, and it's a total of 8 classes. I really enjoy that format because it allows you to develop a relationship with the participants, and I feel like they really trust you by the time you're done with teaching the classes. But I also understand that logistically that can be a somewhat unreasonable request from some participants. So some of the smaller classes are about 4 weeks where you meet twice a week for 2 weeks. I know the CDC and the American Cancer Society have programs and content that are tailored by individual lessons. And so you'd have a little bit more flexibility on how you would present that information, depending on who your audience was. Another thing to look at is the program requirements that can help you kind of decide on which program you want to teach or which program you want to look at. It also helps you with keeping up with the materials and ensuring that you have participants that are going to actually show up and come. So looking at resources, sometimes you have to find funding to support your resources and vice versa. So I know with the Freedom from Smoking program and the Fresh Start program, you had to have books, and it was a requirement of the program is that each participant received a book. And I know from the American Lung Association, the books are about $9 each. That's what they cost me to purchase them. And I know that that is also something that, depending on how your program is set up or what type of funding resources you have available, that may be no big deal. I know for some, it's like we have no funding to allocate towards this or very limited funding. That $9 per participant may be an overwhelming cost. And so those are things to consider when you're trying to decide what content you want to present. And then looking at the support within your organization. Is it just you? Do you have a team of people that can help you? I know whenever I first took this on, I was able to use my students to help me somewhat. But it also, I feel like in order to develop a successful program, you're going to need that additional support, because I have to call these participants. I'm going to remind them when we're meeting. I'm going to get them registered. There's oftentimes paperwork and surveys that they need to take. And sometimes those surveys have to be explained to them on a one-on-one basis. So there is a little bit of paperwork and things along those lines that I kind of take over a secretarial standpoint, that oftentimes if you have support, those type of things can come up, and that might be a reason why you would go with one program versus another. And then obviously funding. Funding is a big one. How are we going to make this happen? So before I get too much into funding, I want to talk a little bit about how we would maybe get into those certain communities if you don't already have an in with the community that you're wanting to reach. Potentially partnering with existing programs. Like I said, whenever I first got into this, I partnered with our local health department, and I just said, are you teaching this topic anywhere? Is there any initiative that you have that I could potentially join in with you? And so that's where I got initially partnered with our local health department. Unfortunately, when COVID hit and everything was at its peak, they were at the time for renewal for their tobacco cessation grant and all of that. Like all funds were reallocated towards COVID relief, which was completely understandable. But that kind of left me at a impasse where I was like, I don't have necessarily a foundation anymore. And so that's where I started looking at what options were out there and decided to take this on myself. So I don't know if there are any schools or universities or any type of health education where you're located that you could potentially partner with as well. That I feel like almost any respiratory school would entertain the concept of helping in this endeavor. But I also know that our nursing program, partnered with our university, also helps spread the awareness of tobacco. If you are looking at after school programs or maybe schools, I know a lot of times getting partnered with the student special interests, whether it be sports or the athletic directors or the band directors, like, hey, you already have these students at a practice. Is there a time in which I can, spend 20 or 30 minutes talking to them? Maybe just a few minutes a week. I feel like sometimes with that age group, small repetitive measures are how you can get the in with them. And then, like I said, with the recovery center that I happen to become facilitated with, they are the company that I deal with, or the organization that I deal with, is they've partnered with many different clinics within our organization. So I'm specifically with the transitional housing group, but they are also associated with a homeless shelter and an addiction recovery organization here in my community as well. So with the addiction recovery, that has become very successful because what we have identified is that there is actually a class that they go to each week that they break them up. And so how they get them in the door is they offer food. It's our Celebrate Recovery. They offer Celebrate Recovery once a week. They feed them when they get there, and then these individuals, they break them up into different topics that they will go and have a class on each week. So sometimes it is parenting skills. Sometimes the topics are job placement and job skills, because a lot of these people do have criminal history. And so sometimes it's difficult for them to overcome and find appropriate job placement. And so what they've decided is this next year, they're going to add me in my program as an additional topic on their Celebrate Recovery nights. And so I'll get to meet with these individuals and talk about smoking cessation as one of their Celebrate Recovery. So this was not something I was necessarily entirely aware of, but I just kept asking, how can I help? How can I reach your participants and your individuals within your organization? And so word is kind of spread. And so you may also look at potentially different pulmonary clinics or different healthcare facilities and see if they are offering any type of tobacco cessation programs. Is there a way that you could get in and assist with either ongoing efforts, or if you could start something up with their patients? So with this, oftentimes I have found is that I had to seek outside funding. Oftentimes funding was not just readily available within any of these organizations or potential community members that I mentioned. And so especially in the under-resourced communities, oftentimes funding is, I feel like, stretched thin. And so there's a few funding ideas that I've came up with here that grants are probably the most profitable because you can get larger amounts of money at once. But I do know that grants oftentimes require a lot of planning and a lot of effort from the individual themselves. And so I know I recently applied for a grant and it took several months to get the information together. And so, but just a few ideas of different grants that are out there that kind of tailor towards this topic is community service grants. I know the Chest Foundation does a community service grant, and that's the American College of Chest Physicians. And so they do that once a year. The CDC also has some tobacco control programs. And there is also a organization known as the Substance Abuse and Mental Health Services Administration, so the SAMHSA, that they have a National Center for Excellence for Tobacco-Free Recovery. So that's specifically looking at individuals who have had a substance abuse history or a mental health history. And so there's lots of potential options out there relating to grants that I feel like this could potentially this project or this topic could potentially relate to, but I do understand grants take time. And grants take a lot of effort. And so sometimes you have to get a lot of parts and pieces together in order for that to occur. So if you're in a little bit more of a time crunch, or you want to see some of this being implemented a little bit quicker, then you might seek funding from independent organizations. So for example, this may be for-profit healthcare agencies or donations from hospitals or clinics that potentially have the funding to offer classes, but they're needing to partner with someone to actually carry out the classes. And so initially, this is what I did for my first class, is that I reached out to a local for-profit concierge medical service. And I knew that this organization had this type of programming. They didn't offer it, but they offered community service type assistance for our local community. So they had made that type of presence known in our community. And so my initial award was $500. $500 is not a lot in today's society, but I'll tell you what I did with it. $500 allowed me to get the books that I needed. And it allowed me to provide tobacco replacement, or not tobacco, nicotine replacement therapy for our participants for up to 4 weeks following their course. And it allowed me to provide small incentives to keep them coming to the classes. And so just depending on where you're at and the cost of things, you don't necessarily have to have an astronomical amount of money to get things started. So I knew I had a small amount, and so I limited my class size to 15 participants. And so just depending on what you are looking at, there's definitely options out there. And then so for my upcoming class, as I'm looking at specific ongoing donations, looking at a donor funding type approach. With this, I have emailed local community members, individuals who I know have been affected by lung cancer and smoking related illnesses. Oftentimes you can get those in memory type donations of any amount. We've also done campaigns on social media where my students helped me create commercial like reels. And so for that, they spread the awareness of tobacco cessation. And after that was all over, they created a code in which we were able to share that if you'd like to help support our efforts in spreading tobacco cessation awareness, you can donate to our cause. And then there's also special events. And like I said, these special events don't necessarily have to be, you think of donor dinners, you think of fancy sit down type dinners, but a special event I did with my students is the Great American Smokeout is a campaign that is advertised through the American Cancer Society, and it happens the third November of every year, the third November. Sorry, that's not the 3rd November, third Thursday in November. And so whenever that happens, they encourage individuals to stop smoking cold turkey for 24 hours as the kickstart to their tobacco-free journey. And so what my students did is we dressed in funny costumes and walked around the common areas in our community. And they got attention because they were holding up signs that said, they were dressed like Christmas trees and elves. And it was like, give your family the gift of you this holiday season. They were dressed like clowns and had a birthday cake. And they said, celebrate more birthdays. They were dressed in dinosaur costumes that said don't go extinct, give your family more time with you, different things like that. And then we do also have obviously a large cigarette costume in which we were able to share our true message, which was to stop smoking, and individuals were stopping like crazy to donate to our cause as far as that goes. So it doesn't necessarily have to be a big elaborate dinner in order to generate some level of funding. And like I said, $500 is all that it took. And I didn't take quite the full 500 to get my program started from the very first time. Okay, so how are we going to put this all into action? How are we going to make it happen? So from the perspective of teaching the content, you're going to have commitment. You're going to have to be committed, because what I found is that under-resourced communities sometimes make it more difficult to hold the classes because the participants may struggle with transportation issues. They may struggle with legal concerns that prevent them from being free to come to the classes. Sometimes they have personal struggles outside of the content covered in the classroom, so they may have personal issues going on. We also found that addiction, relapse, is sometimes something that occurs within that particular community that I was working with. And so sometimes it's easy to become discouraged or even frustrated with the process. But I feel like it's important to take the perspective that we should expect frustration, frustration from the participants, frustration on our end, but you have to have that endurance to keep going. The latest statistics show that most smokers require anywhere from 8 to 10 attempts before they quit for good. So I don't know about you, but quitting or just approaching anything that took me 8 to 11 times, I probably would have given up before then, if I'm honest. So just having that endurance to keep on, to keep offering the classes, to keep reaching out to the participants, to keep showing up with enthusiasm, to remain engaged in the content, remain engaged in their participation is really, I think, a key piece to having a successful tobacco cessation program. So I like to tell my participants that even though they may miss a meeting or they may miss 2 meetings, I'm still going to reach out to them. I'm still going to stay in contact with them. And if they're willing or they're willing to make the effort, I will try to catch them up on the content. That I had one participant in the past that after our quit day, we had a big celebration about midway through the program. That was her quit day. And she got some very upsetting personal news, and she smoked that day. And so she was afraid to come back to the program because she was afraid that I would be so upset with her. And so I had to, reinforce those concepts that yes, it's not what I would like for you to have done, but absolutely that does not make you a failure in this process. So that has a lot to do with accountability, that the Freedom from Smoking program actually requires that all facilitators be smoke free. And so we have to oftentimes model the behavior that we're expecting. Don't require expectations that are unreasonable. So I feel like in that instance where she admitted to me that she had like a small relapse, don't approach those individuals from a perspective that is harsh and judgmental, because this is a process. Quitting tobacco is it is an addiction. And so it's something that has been learned and something that is going to take time to break. So oftentimes I want to reinforce the concept of setting goals that are achievable and goals that we can accomplish together as well as independently. So that has a lot of that follow through. If they're going to hold up their agreements with me, agreeing to change their behaviors and through the process of the program wean off of their nicotine product, then I have to hold up to my agreements. I have to call them when I say I'm going to call them. I'm going to show up when I say that I'm going to show up. And then if you have the funding to follow up with these participants after your content delivery, the program has ended, the better. So I just reached out to a couple of my participants over the last week, and one of them, he was a 3-pack per day smoker. Yes, 3 packs per day. I triple checked that information to make sure. And he told me this last week that he is still not quit, but he is down to a half a pack a day. So in 3 months, we have gone from 3 packs to a half a pack. In my world, that is it. In my view, that's a win. We are getting so much closer to him. And he immediately responded to my messages, and he was like, "Oh, I was thinking about you too. I can't wait to be completely smoke free. And if I get a chance, I want to come and talk to you again." And so instances like that, when you build that community and that trust within your participants, it really makes for a successful program. And then the participants will become recruiters for you. So looking at the topic and what you actually teach whenever you're looking at teaching tobacco cessation, I feel like there are a lot of misconceptions out there, and not necessarily that any of these statements are untrue, but I just want to shed some light based on my own personal experience on teaching these classes and highlight these misconceptions. So a lot of times individuals will feel like smokers in under-resourced communities are uneducated, and statistics will support that statement. So according to the CDC, more smokers have their GED than they do high school diplomas. So there is definitely a connection there where they are not necessarily the highest of educated individuals. But what I have found is just because they don't have the diploma or the college experience or anything along those lines as formal education does not mean that they are ignorant or uneducated about tobacco cessation. So looking at my experience with these individuals, what I found is they treated me like a fact checker. So I almost couldn't get to all their questions. So I just introduced the concept of tell me what you know about tobacco cessation. Tell me what you know are the risks. They immediately wanted to know what popcorn lung was. They wanted to know what menthol was doing. They wanted to know why vaping wasn't better. They wanted to know how it was affecting their lungs. They were giving me specific examples of how they were breathing and what medications they were taking, and a lot of information. Like everyone was, I can't explain how they were spewing the information at me, and I was instantly in that moment their truth checker. Is this true? Is this true? Is that true? And so if you think about it, even in these communities, and I think even in the youth, is they have those smart devices in their hands a lot of times, and so they can find the information that's out there. And at this point I was more of, what can you trust? What can you not trust? And so it's important to present these individuals with information beyond smoking's bad. Here's the list of why it's bad for you, and here's why it's bad for your health, and here's all the things in your health that are going to go wrong. And so looking at that, health risks should be the primary focus of cessation. I do believe that yes, there is a lot of information that can be shared relating to the health risks. But also whenever you look at quitting tobacco, like I said, nicotine is an addiction. And so it's also important to consider the mental health and the social well-being of your participants, and how when they go on their quit journey, how their mental health and social health will also be affected. And then a lot of individuals I feel like, believe that vaping is a safer form of nicotine use, and that's just simply not true. There are different risks associated with vaping, and I'll talk a little bit about those in a second. And then also the fourth fact that I found when teaching these individuals is they really had no understanding of what third-hand smoke was. They had a very good understanding of what secondhand smoke was, but they believed just because they went outdoors or they removed themselves from their family members, that's all they had to do, that there was no other risk or no greater risk because they were only exposing themselves to the byproducts of smoking. And so they believed that that was all that was required. And so these are important topics that I think every program should hit on. And I incorporated a few hands-on type activities in teaching the content, because I feel like just this format of delivery of, here, let me tell you about all these things that are bad, and let me tell you about all the reasons why you should quit, and here's the process of how to quit. Having these hands-on activities are what really hit home with these individuals, and I feel like this applies almost in any community. And so here's an example of where I had swine pig lungs. And obviously you have the healthy lungs compared to the unhealthy lungs. And these individuals kept asking me to bring these out or get these back out because they wanted to see them again. They wanted to take pictures. They wanted to talk to their family members about it. They wanted to show their family members these pictures. And so this is a particular activity that was extremely popular with them because they almost couldn't believe it in front of their own eyes. And I do understand that, there are potentially animal rights activists that may not appreciate this particular activity, but I do have a few others. This particular set of lungs runs about $450, but you can use them for quite a long time if you take good care of them. Also, in covering the topics related to low-term birth weights and pregnant individuals who smoke, I have a premature mannequin, which looks like a baby doll that is extremely small. And so just bringing that out and showing that to them, that was a real eye opener, because I think a lot of people can relate to, oh, premature infants, nobody wants to have one of those, but then actually holding it in front of them and letting them see a lifelike individual that is the size of their entire hand. That was an extremely eye-opening experience for them. And I even had a participant after the program who came and told me that she was expecting and that she was pregnant, and she was afraid to tell me because initially her experience in previous tobacco cessation topics were that she felt very judged. And so this was an opportunity for me to elaborate and explain, that that's not what I mean by this. And I would really like to become that messenger for you. And so I have several examples of different activities that I have can share. Barriers to quitting. Excuse me. There are significant mental health concerns. So tobacco use is much higher in individuals with known mental disorders. That a lot of youth report that they are also substance abusers beyond just tobacco users. Individuals with PTSD are a lot more common to be smokers, as well as individuals who suffer from clinical depression. So looking at the mental health side effects and the mental health concerns, I think it's important to be very upfront with these individuals, because whenever you go to quit, there is a lot of mental and emotional concerns that can come along with it, such as these listed here, that 19% of smokers have a diagnosis of depression. Nearly 28% of them have been admitted regularly to having feelings of severe psychological distress. So it's very important that whenever we go to quit, and that's one reason I like a lot of the group type settings, is because you develop a buddy system. And so they can help you have someone to turn to during your moments of struggling. There are hotlines, chat groups, fellow smokers. And so that's what we can find here on this link that goes to the nicotine support groups. And then another important aspect that this was not something I was initially prepared for, was the social loss. That when you look at breaking the chain of addiction, you have the physical components, which are physically, what are going to be the withdrawal symptoms. Then we talked about the mental barriers, but then there's also the social barriers that a lot of times smokers, whether it be vaping or tobacco use, it's a social aspect where I have my coworkers that I smoke with. I have my family members that I smoke with. I have my close friends that I smoke with. And so whenever you're trying to quit, one of the strategies to quit is to avoid those triggers, avoid those individuals. And so especially in these under-resourced type communities, is their question to me was, what else can I do? Because they felt like they were having to give up their friends, having to give up their time spent with their coworkers. And so they were really at a loss of what to do with their time and who to turn to. So they felt like they had, in many ways, lost their entire support system. And so their particular motto was, sober people hang out with sober people. So they felt that non-smokers should hang out with non-smokers. And in the beginning, and that's very true, that is one of the strategies for helping individuals to quit. And so I helped identify, I feel like one of the best strategies is to help identify free or low cost gatherings in your area. So one of the nights I took them to the park, and we had our meeting that night at the park, where we played disc golf and basketball and just did things that they were not necessarily aware of that our community had to offer. And then also I incentivized their participation for coming to the program, that if they came to every program or every meeting, they missed no meetings, that I would put them in for a drawing for a gift card to a local restaurant. And so that was something that they weren't regularly accustomed to. And so that was also an incentive for them to keep coming. And then I think it also is important to just reinforce their why they want to quit, having them set goals. But I understand the goals are very different when you're looking at under-resourced communities, because I've taught this with the general public, where our goals were anywhere from, my wife said I could have a boat if I quit smoking, and I could buy a designer purse if I gave up this habit. But in the under-resourced communities, it's very different. For example, I had someone who they wanted to save money to be able to take their family out to dinner. They wanted to go to take their family to a restaurant. And so you can see where kind of the goals change. They wanted to be able to afford a sit-down dinner. And so just making sure you help them reinforce and identify their why and reinforce that goal. So when looking at vaping, and we've got some special considerations with vaping, especially if you're looking at the youth and their ability to somewhat hide the electronic cigarette, we have a whole different set of concerns on our hands, in a sense that it's still nicotine. We're still delivering nicotine in a device, but these devices, these electronic cigarettes, allow them oftentimes to manipulate the amount of nicotine that they're getting. So we get some kind of a different aspect of quitting, because cigarettes have a absolute amount of nicotine per cigarette. It's able to calculate exactly based on how many cigarettes you smoke in a day. We're able to quickly identify how much nicotine you've consumed. Whenever we look at vaping, especially if they have the refillable forms, sometimes it can lead to less frequent use of the device, but sometimes greater nicotine content when they are using it. And so this leads to somewhat of, I feel like, and I don't want to come across as all vapors do it in secret, but it does allow them to be a little bit more secretive in their delivery of the device, because it creates that vapor. And there are actually devices out there that they can exhale into, where they could be using it in public and you wouldn't necessarily know it. So we get more frequent use of nicotine oftentimes with our vapors. So that's why it's really important to understand that vaping is not a replacement therapy and not a substitution. So again, looking at vaping, the self-filling portions allow us to adjust the nicotine to the amount that we want. And oftentimes those can lead to what's known as the popcorn lung. There are electronic nicotine devices that are easily made at home. So that's where this can become very popular form of delivery in like I say, middle schools and high schools. And I will say, even my daughter last year, when she was in the 5th grade, she had a student that brought a vape to school. So it's not impossible that you will see it even younger than that. But with this, it makes it very, like I said, very difficult to address the appropriate nicotine replacement therapy, because it's harder to identify how much nicotine they're actually consuming. Because it may be, I take 3 vapes from my pen every hour. Okay, well, how much nicotine is in your pen? How much is in your pod? How much are you using? And then it may be, oh, I have no idea how many I take. I just take a few puffs throughout the day, but I may take anywhere from 50 puffs a day to 200 puffs a day. So nicotine replacement therapy gets very, very, very tricky when we look at vaping. So moving on to this last concept is the second and third hand smoke. No amount of secondhand smoke or vaping is safe to inhale. Again, most smokers believed when they moved outside that they eliminated that risk to others. But third-hand smoke actually refers to the residue that's left on clothing, fabric, skin, and hair after smoking. And after it's left on your clothing or any surface that you've come in contact with, maybe the inside of your vehicle, anyone that comes in contact with your clothing, your vehicle, your skin, it can be transferred to them. It can also be transferred to other objects. So let's say, like for example, it was this individual that kept their grandchildren, and their grandchildren's toys were left on their couch. They sat on that couch, they played on that couch. Now that content is now being transferred to their grandchildren via that method. So it puts children at a greater risk of developing respiratory related illness whenever their parents smoke. And a lot of times I think that they think, I even had a friend who she's like, well, I never smoke indoors and I never smoke in the car with my kids. There's still an increased risk of occurrence of respiratory related illness as infection in children, and also an increase in the risks of SIDS deaths among children who are exposed to smoke. So this is actually a study I found where they investigated the third-hand smoke, where what they did is they took pillows and put pillows in the homes of individuals who had quit smoking. And whenever they quit smoking, these pillows were placed in their homes. They never smoked again. They left these pillows in for a series of 4 weeks. And then they took these pillows and analyzed these pillows for nicotine content. And this is what they found, that the greatest amount of nicotine content was found on the pillow itself. Then the cover on the inside of it still had some, but then after that, even the filling of the pillow itself still had traces amounts of nicotine found in it. So can you imagine smokers who have quit smoking, but they'd previously smoked in their home? The only way to truly get rid of all the nicotine content would be to replace all the contents of your home. So again, third-hand smoke is something that a lot of people don't readily recognize. And so that is something that really hit home with these individuals, especially parents, because they didn't realize that they were exposing their children to these toxins because of their ability to smoke, even when they were taking efforts to smoke away from their children. Then lastly, I think it's important to prepare individuals for the withdrawal symptoms. I think sometimes people try to avoid putting a lot of emphasis on the withdrawal symptoms because it's not pleasant. It's not the fun part of any of this. But I feel like it's very important to be upfront about it, and helping these individuals overcome these obstacles is letting them know this is what's going to happen, and helping them understand why they might need nicotine replacement therapy and what nicotine replacement therapy to use. So I know sometimes the nicotine replacement therapy, we can look at gums, we can look at breaking their routine, simply keeping your cigarettes in your car, not bringing them into your home, having to take that extra effort to go outside and get them. Just changing up the routine can somewhat be frustrating, but also it works as a very successful method of getting the individuals to break up that habit of, oh, I just wake up and smoke. And so there's a lot of planning that kind of goes into the quit routine. And so this is where beyond my own experience, I feel like it's very important to rely on those trained tobacco treatment specialists, as well as physicians and medical personnel that can help with the nicotine replacement therapy. But I also understand in the under-resourced communities, nicotine replacement therapy and readily seeking medical assistance is not something that these people have access to. So I use the gums and the lozenges personally because I felt like I was able to closely match their nicotine content and help them understand what the potential side effects would be, as well as the medications themselves. I was not comfortable with these individuals because a lot of them did not have regular physician oversight of their care. And so that's where this also gets a little bit difficult, is because I didn't want to be responsible for any potential side effects that they might have, but I wanted them to be upfront and honest. Like, when you use the lozenges, here's what you should see. And if you experience any of these symptoms, this is when you should stop and seek additional assistance. So it's important with nicotine replacement therapy that you are actually weaning off the nicotine and not just replacing the nicotine. So again, the nicotine should be weaning down slowly, not just replacing one form for another. So my biggest takeaway, my biggest point that I wanted to make with you guys today before we run out of time is that spending time with these individuals allows you to become the trusted messenger. And so I feel like smoking cessation, regardless of what you choose, how you choose to go about it, you should never approach it from a judgmental or scolding perspective. You want to remain up to date on the facts and what programs are available in your area or how you can partner with those programs. You want to seek out additional information and what resources are available. and then offer encouragement at each phase. It should never be one of those, oh, you failed and we're done. Like I said, most individuals take 8 to 11 attempts before they're successful in actually quitting. So help them determine their why, help them stay on track. Sometimes it's okay to admit that right now is not the time that they should try to quit, that sometimes right now they need to address their emotional concerns. They need to address their mental concerns, what personal issues they have going on, that trying to quit on top of that is not necessarily something they should do, but helping them identify their goals and their why and letting them know when they can come back to you or when they should come back to you. So you want to become that reliable resource within your community. And then here are a few websites to a few different smoking cessation resources from the American Lung Association, the CDC, and the American Cancer Society. And then a few different ways that you can get involved within your communities if you aren't looking to start a program but want to get involved and see how you can help support in teaching tobacco cessation materials. There's a few different ideas that I have listed here. But I think it's very important to get connected with your area of interest. And once you get connected within that community, you become a trusted member, and you would be surprised how easily things fall into place after that. Here's my references, and I know I'm cutting short on time, but do I have any questions?
That's good. Thank you so much. This has been a great information session about tobacco cessation, especially in the under-resourced community and the specific community that you've been working with. We really appreciate your time. We do have time for a couple of questions. And so one of those that we have is asking about, do you have a online or telehealth option for your program in the event that people aren't able to attend face-to-face?
So I don't currently offer it, but I do know that the American Lung Association, I don't offer it currently with the way I teach the program because I'm partnered with my students, but the American Lung Association does support the use of virtual classes. And so if I have the opportunity to offer more classes, that's definitely something that I could do. Yes.
Okay, great. And then one of the other questions here is also looking at nicotine-free campuses, that if you are either a school nurse or working in a facility that you have a nicotine-free campus, specifically to school nurses, what would you suggest school nurses possibly do to help their students maybe with tobacco cessation or nicotine withdrawal? Is there anything that can be done that you're aware of?
So with that, it's kind of a gray area in a sense, because I feel like to some degree you need to have parental involvement for appropriate nicotine replacement therapy if it's needed.
Right.
I find oftentimes in the youth, sometimes it's one of those things that they do as a habit just to look cool in front of their friends, that it may not necessarily, their nicotine consumption may not be as high as it would be for individuals who can legally obtain all of these materials. Sometimes it is, sometimes it isn't. So I think it's important to address and come up with a strategy that you can use like campus wide, as well as potentially seeking expert advice from maybe a medical, maybe physicians on what the appropriate cessation would be. But I honestly find that just weaning them off
is best.
Yes. And it's also sometimes hard with those the nicotine or tobacco free campuses, because that's only as much as you enforce it, unfortunately. So really it has to be has to be appropriately enforced in order for it to be effective. Right,
exactly. So one of the last questions is, would you be willing to share results or evaluation of the program that you have so that people can learn from that? And this might be something that we could include in our follow-up resources that are posted. What are your thoughts?
Sure. Like I said, I've only the program, the way that I'm currently teaching it with the transitional housing, I'm coming up on my second year, so I don't have a whole lot of results. So I'm fairly new in that aspect, but yes, I'd be willing to share as I get it. Yes, absolutely.
Okay, thank you. Great. Thanks so much. Well, we want to thank you, Jessica, for your time today. This has been an informative webinar. Our next webinar is on October 15 at 4:30 p.m. Eastern, when we'll welcome Dr. Clint Dunn to discuss atopic dermatitis and the JAK inhibitors and beyond. You'll receive an email from Zoom in a few days with a link to the recording and evaluation and supplemental resources. Thank you again from all of us at Allergy Asthma Network. Join us as we work every day to breathe better together.